Hi, everyone. I'm Dr. Mary McCone with BrainWorks, and I want to talk to you a little bit about neuroreflexes, or primitive and postural reflexes is maybe how you've heard of them. So, what might make a child more likely to have these retained reflexes and thus not be functioning in the way that we'd hope? They're not flourishing, right? We're concerned about them. They may have autism or ADHD or dyslexia. Um, we can see retained reflexes in Down syndrome, certainly cerebral palsy. What would make them more likely to have these retained reflexes? Well, here's a few questions to ask yourself. Was your child a C-section? Were they a planned C-section or emergency C-section? The outcomes matter. Were they a preemie or an ultra preemie? Ultra preemies have an even more difficult path because they were born so early that some of their reflexes didn't even get to emerge yet before they were born, and they were born with underdeveloped proprioception and vestibular senses. Was your child a NICU? Was there some medical complication at birth? Were they hypoxic? Was the cord wrapped around the neck? Was there fetal distress? Was there anything else abnormal about the birth situation? All of those things can be precursors or causes for why a child their reflexes might not have emerged and matured and integrated when they should have. There's also some kids that it's a big question mark. We don't know why it happened. But 95% of the kiddos that I work with had some kind of birth trauma that affects gene expression. It affects the way that these patterns are supposed to emerge. So if you're worried about your kiddo and you think, I wonder if they have retained reflexes, come visit me, www.brain-works.org, or you can join our Facebook group. We're a 20,000 member group at Reflex Integration and Brain Training. It is a Facebook group. If you have any questions or comments, leave them below and I'll get back to you. Thanks so much.